Thanks, Emily. Now you would have a strong indication about the clinical psychological perspective of alcohol and also an understanding of alcohol consumption being classified as a disorder. Moving forward, I will be presenting part 2 of 3 about inappropriate and excessive alcohol abuse. Particularly, I will be investigating the clinical effect of the brain resulting from alcohol abuse, explored through a clinical neuropsychological perspective. The origin of alcohol has dramatically changed over time, as you can see on the right there. Globally, in 2010, alcohol misuse was the 5th leading risk factor for premature death and disability. Joseph Frasselli, the Director of Clinical Neuroscience at the National Institute of Drug Abuse, defined an addiction as a repetition of behaviour in the face of negative consequences with a desire to continue, aware of how bad it is for yourself. The etiology. Most commonly, the well-known short-term effects alcohol has on an individual is dizziness, lack of judgment, memory loss, slurred speech, blurred vision, and potential alcohol poisoning, which can be fatal. Most individuals are aware of these effects, but do we know what goes on in the brain? When an individual consumes alcohol, what we are actually digesting is ethanol, a small molecule soluble in water and fat within the body. This molecule dances around the body through fluid and tissue and also into the brain. Alcohol will depress the neural activity in the brain, and as alcohol is a depressant drug, this kind of makes sense. It also exerts the main pharmacological effect by dissolving in the outer membrane of existing neurons. Inside the brain, another structure which is affected by alcohol is the ion channels, which transport positive and negatively charged particles in and out of the neurons. Eventually, this reduces the neural excitability, which is how ion channels of calcium and sodium travel in and out of cells. Research has tested alcohol consumption on rats and has found that there are noticeable deficits in brainweight and volume. However, such deficits within gross measurements were not found in the development of the hippocampus. This was an unusual finding, as other literature has supported excessive drinking can make the hippocampus more vulnerable, leading to memory loss and increase the chances of Alzheimer's disease. Further, investigation in the hippocampus explains the cognitive deficits in alcoholics, although at this stage there is nothing that can reverse the problem from drinking. Stress-induced effects on the hippocampus are reversible, but alcohol effects are not. Research suggests drinking is also likely to be genetically predisposed, with the studies suggesting individuals more likely to have issues with the hippocampus are predisposed to alcoholism, with females having less tolerance to alcohol. Studies looking at the cortical grey matter in the brain, depicted in the picture on the left there, found differences in alcoholics. One finding suggested reduced whole brain, prefrontal and parietal cortical grey matter compared to those who do not drink heavily. Loss of grey matter is problematic, as grey matter in the brain controls the neural cell bodies, as well as muscle control, sensory aspects such as memory, hearing, motion, and speech. Interestingly, the same experiences an individual has after one night of heavy drinking. Knowingly, more research is needed in this area. The effects on the brain from excessive alcohol abuse can be catastrophic, but how do we help fix this? How can a clinical neuropsychologist effectively provide treatment and/or a service to assist in this disorder? So solving this as a researcher, we know that excessive alcohol disorder can increase the probability of Wernicke-Korsakoff syndrome, a serious brain disorder, which 80% of alcoholics will develop. This disorder is broken into two, a short-lived and a severe condition which can bring on mental confusion, psychosis, paralysis of the nerve, which moves the eyes around, and coordination from the muscles. Neuropsychologists need to be aware when speaking with alcoholics. Not all symptoms may be apparent. This doesn't mean that the individual with alcoholism doesn't have the syndrome. Research has proclaimed autopsies after death have shown how many individuals were not diagnosed, as they only showed minimal symptoms. As with this syndrome, there are deficiencies of thiamine. Research supports in the early stages administering this back into an individual assists with brain functioning. Genetic predisposition can also increase the chances of this syndrome. More research is needed for severe cases of WKS, as currently there is not much that can be done. At Yale University, researchers supported the 90-day rehabilitation model for alcoholics, such as AA. Findings highlight how a 90-day duration is how long it takes to reset the brain, so to speak, and lose the influence of a drug, and thus theoretically there is reason to believe that this is a promising program for individuals. However, there are so many factors like genetics, stress, gender, SES, the list goes on to actually stick to this program, which is why addiction can be treated by a neuropsychologist in sessions, on a one-on-one basis at the desired pace to help the individual. Fetal alcohol syndrome is how the brain is affected when a mother is drinking during pregnancy, with scientists currently working on medication to prevent brain damage as a child. Further research found individuals with early substance abuse onset are more likely to have this continue into adulthood, with individuals having alcohol before the age of 14 or younger have a 5 times increased risk of lifetime alcohol use disorder compared to those who legally drink at the required age, such as being 21 in America. Therefore, research needs to educate individuals who are pregnant to limit a younger population increasing alcohol abuse. Continued research is needed in this area, as such research can assist in the effects alcohol has on the brain and protect the brain of alcoholics. So solving this as a practitioner, evidence-based therapy suggests a couple of therapies that should be used when assisting with drug and alcohol counselling. Cognitive behavioural therapy, or CBT, is supported by extensive research for addiction. It is utilised to not only assist with the addiction component, however, usually addiction carries negative and/or destructive thinking, as we know it's a repetitive behaviour that causes this addiction, and thus looking forward into depression is also considered for treatment. Individuals with addiction have negative thinking patterns, which is paramount to the disorder, and such thoughts lead to their feelings of powerless and a lack of control while suffering with their addiction. A clinical neuropsychologist can explore an individual's behaviour which leads to such actions and determine why they're having these thoughts. CBT also focuses on coping strategies around stresses or triggers that lead to drink, such as a family drama or work stress, and how drinking can take the edge off and calm the body. Motivational interviewing was first described in 1983, so not all that long ago, by Miller. The theory is defined as directive client-centered therapy, which elicits behaviour change by helping clients resolve ambivalence. Miller has also stated, once a client reaches ambivalence, they're nearly there at getting over their addiction. Motivational interviewing for alcoholism and addiction is to help clients sort out their current or their potential current problems, especially who are reluctant in doing so. The aim is to change and shape motivation in a supportive way rather than imposing necessary changes. A study in 2009, first of its kind, used CBT and motivational interviewing around internet addiction, which also works for gambling and alcohol abuse. The aim in the session is to focus on reducing the addiction and expanding real-life social contact, reframe these beliefs, develop a new daily structure. Neuropsychs focus on belief as the core, which is how CBT plays such a large role, but also compares life to those without an addiction and speaks about this. Research has shown results within behavioural changes when in one-on-one sessions implemented show great results. So where to from here? So much is understood about the brain as a function in the human body, but so much more needs to be taken to understand the responses and the reaction to the brain in relation to excessive alcohol disorder. Hopefully now there is a strong indication how alcohol does affect the brain and the individual, and how a neuropsychologist can assist in therapeutic techniques to limit this behaviour or habit, which then leads to an addiction. Amy will now speak about the forensic perspective and how alcohol can lead to criminal behaviour.